I am Dr. Madhurima Vidyarthi. I'm a consultant endocrinologist at Neotia Mediplus, and on World Thyroid Day I would just like to make you aware of some commonly known thyroid problems that we encounter in our outpatients. So thyroid problems are picked up in two ways, either on a routine blood test. I am talking about a first-time diagnosis. The patient can have a routine checkup and discover that the thyroid blood tests are deranged, or they can have certain symptoms either of hypo or hyperthyroidism, which can then lead to further investigation and the relevant blood tests leading to a diagnosis. Sometimes they notice a swelling in the neck where the thyroid is, and then that warrants further investigation. Of the three most commonly seen thyroid problems in the outpatients, I would like to talk about hypothyroidism, hyperthyroidism, and thyroid swelling. Hypothyroidism is when our body thyroid gland does not make enough thyroid hormone for our body needs. So this results in TSH, which is the brain hormone which tells the thyroid hormone what to do, the thyroid stimulating hormone rising. And the hormones that are made by the thyroid, the free T3 and the free T4, then drop. We treat this by giving thyroid hormones in tablet forms. Usually this is a lifelong condition and the medicines have to be taken for life. If the thyroid is slightly raised during pregnancy, then the condition is treated appropriately and the condition is reassessed after the baby has been delivered. Hyperthyroidism means that the thyroid gland is making too much thyroid hormone. It is secreting an excess, which then leads to certain adverse effects and unwanted effects of the thyroid hormone, like weight loss, hair fall, and shivers, tremors, palpitations, certain things like that, or changes in the eyes. In that case, we have to do certain special scans to find out whether the whole gland is overreactive or whether only a part is overreactive, whether this overreaction is temporary or has been present for some time, and accordingly the condition is treated with medication or surgery or a combination of both, or also something called radioactive iodine in certain cases. Thyroid swellings or thyroid cysts, which are sometimes picked up on ultrasound, are slightly different in the way we treat them, because we first have to see whether the thyroid is just swollen or whether it is also malfunctioning. If the thyroid is simply swollen and there are no cysts in the thyroid that need to be investigated further, and the thyroid blood tests are normal, the removal of the big thyroid or a reduction in the size of the thyroid is then purely a cosmetic procedure, which depends on the wishes of the patients and whether or not it is obstructing any structures in the neck, causing breathlessness or problems in swallowing, or changes in the voice, etc. If there are cysts in the thyroid, then these need to be reassessed with special scans. Sometimes even a biopsy is needed, and then we have to make a decision about how to go further. So if sometimes there is a cyst or a nodule which is unreactive, then we let it be and we simply monitor it. Sometimes a nodule may be overreactive, in which case we have to consider surgery. Sometimes a thyroid swelling may have multiple cysts and multiple nodules, called a multinodular goiter, and then we may consider removal of the thyroid gland in the suspicion that one of these nodules may show certain cells which are not benign. So these are the commonly faced problems in the OPD that we come across when we think of the thyroid gland. If you think you have a problem with the thyroid gland, please go to a specialist. An endocrinologist is the person who deals with the thyroid, and make sure that the treatment you receive is specific, the diagnosis is correct, and the management appropriate. Thank you very much for listening.